The following webinar was recorded as part of the original implementation of IWISH and has been made available for informational purposes only. Some portions of the original recording have been cut to ensure participants' privacy. References to the Lewin Group, implementation team, site liaisons, PHL, Google Drive, and some forms are not applicable to the demonstration extension effective October 1st, 2020. Terms and conditions of grantee's cooperative agreement supersede any information presented here. Please see the IWISH Operations Manual for the most up-to-date implementation information.
Good afternoon, everybody, and thank you again for attending today's fifth event in our IWISH training series. Today we're going to be focusing on getting to know your community and understanding and going into action in terms of identifying partnerships that can add value to your demonstration. The goal of our training series is really to focus on preparing you and your program for demonstration implementation. So thank you again for joining us.
So I want to start out by saying that, IWISH is a team sport, and this is really a foundational concept. And with IWISH, it's not about, you all, the wellness directors and the wellness nurses working in isolation and having to become experts in all matters that are presented to you by your residents. Really, on the contrary, what IWISH is going to be about is you working as part of a larger team that's really coordinated and working in unison on a shared mission. And you see this picture on the slide here, what you see is a rowing team. And if you look really closely at this picture, you'll see the first person at the bottom of the picture is looking not the way the other people are. And that is what is called in the rowing world the coxswain. That's the name of that person's position. And what I love about this is that when I think of the coxswain and what their roles and what their responsibilities are, the definition of a coxswain in the rowing world is that it's the person that's responsible for steering the boat and coordinating the power of the rowers. And so what I want you all to think about is that your resident, your participant is really the coxswain in this IWISH program, and you're going to be working in unison, in coordination with the other partners that you gather together to do this work, and working in unison and coordination. So I hope that helps you get a visual of what we're looking for. Okay, next slide. So let's talk about why partner. What's the big deal here? Well, there's so many reasons, and based on that, it's through the further partnering with community organizations that we've been able to have a much broader, much more expansive program. So first of all, partnering will expand your team. So beyond the core team of the wellness director and the wellness nurse and the resident, by keying into key community partners, you're going to be able to expand the supports and the services you can bring to your residents. The partnering is also, when it's done well, and can be truly the antidote to duplication. If you have partnerships where there is regular and consistent communication and you have shared goals, that is when you're going to start stamping out duplication. This really hit me in the face early. We had one of our first kind of meetings of the key partners that we decided to bring together to expand. And we had, at one of our first meetings, we had a representative from a home health agency, and we had a representative from what we call one of our local area agencies on aging. And we were discussing a particular participant that was frequently visiting the emergency room. And what we found out after a little bit of discussion is that both of those partners at the table, the home health social worker and the area agency on aging social worker, they found out that they had both been serving and providing services to this participant for about 4 months, and neither of them knew that the other one was doing that. And they were focused on really similar things, which was around falls prevention and getting this participant set up with physical therapy. And it ends up that the participant just never told the person they were seeing that there was someone else also doing that. So that was a major light bulb for us to realize that, the way that we can, figure out if there is duplication going on is by actually getting together and partnering in a more consistent and regular way. Another reason why it's important to partner is you really want to increase the resources and the expertise that are available to your residents. Again, you are not going to be expected to become an expert in all matters that come before you from your participants. What you want to do is reach out to the expertise that already exists in your community. And then lastly, partnering is going to enhance the coordination that is available for your participants. And the better you know your partners and what they do, what their organizations can offer to add value, the easier the coordination is going to happen. It's going to happen easier, and it's going to happen faster. So really, really important. Next slide, please. So we know why we want to partner, and the next thing is, who do you want to have on your larger team? And as you know, I'm sure there are so many different organizations out there with similar missions to what we're trying to do here with IWISH, which is to help people stay healthy and stay at home. So where do you even start when you're thinking about who to reach out to? And what this slide shows are three categories of organizations that I would recommend that you start with. So there's kind of this category of health services, category of social services, and a category of mental health services. And there's certainly some overlap between the three of those. And before I get to some specific examples under each of those categories, I wanted to take a minute and hear from you all. And so what I'd like to hear, go ahead to the next slide, is, what are you already doing? What social services providers do you already work with successfully? Or if you're not partnering yet, what providers are you thinking you'd want to develop relationships with in the next few months?
And Molly, this is Chrissy. While people are typing away furiously in their group chats, again, group chat is in the upper right-hand corner, the same widget that you used to put in your name and stuff. Can you tell us one of the social service providers that you really like as we're waiting for people? And as I say that,
Yeah.
It's going crazy in group chat now.
Okay. I have lots of examples. I think one of the really important social service providers that we realized early on we wanted to partner with what is the Area Agencies on Aging. And I know they're called different things in different parts of the country, but hopefully that gives most people an idea when I say area agencies on aging, they know what I'm talking about. So that's definitely kind of a definite go-to for partnering.
Yeah, and I think it was like you were reading the group chat as you were talking. A lot of the participants have put in that they're working with the area agencies on aging. A lot of them are talking about that. Salvation Army is another one that people are working with. CMS Medicare, a food bank. There's some really great ideas in here. There's also somebody who wants to actually work more effectively with adult protective services, and others who are developing relationships and learning from their coworkers in terms of what they can be doing in the future. But it looks like Area Agency on Aging is one that is popping up all over the place. So that was great. Substance abuse also, I just want to highlight that one. Some people are wanting to develop relationships with substance abuse agencies. And again, everybody can continue to put things in the group chat. And like I said on last week's event, this is a perfect opportunity for you to go through and mine the ideas and the suggestions of your peers within the group chat. Of course, we will send you a list of cleaned up partners that were noted during today's webinar, but I encourage participants to read through some of these so that you can kind of steal shamelessly from one another and get some ideas that might not have been on your radar before. So
yeah, super, great.
With that,
no, I'm looking at a lot of these responses, and they're fantastic, and many of the ones that I'm going to be sharing with you on the next slide. So if you want to go ahead and go to the next slide, I can dig in with some. Yeah. So here's some in the social service category, some of the agencies that we have found really key part, the transportation agencies, and there's a kind of specialized agency here in Vermont, and I'm pretty sure they're federally funded across the country, that provide specialized transportation for older adults and adults with disabilities, and they often provide no-charge rides for Medicaid recipients to doctor's appointments. Sometimes they'll offer rides to grocery stores. So those specialized transportation agencies are really important for you to partner with. I have on here, obviously the area agencies on aging, they do so many things with us as partners here, whether it's helping provide fall prevention classes, Tai Chi class trainings, Matter of Balance, Meals on Wheels, all kinds of things. The Alzheimer's Association is, every state has a local Alzheimer's Association, which has tremendous resources for challenges you might face with cognitive issues with your residents. We partnered successfully with our local Alzheimer's Association to bring one of their really wonderful educational presentations on the 10 warning signs for Alzheimer's disease to most of our programs across the state. Local YMCA, they released a diabetes prevention program that's evidence-based, and that's been a wonderful partnership we've had to that. I think it's an 8-week program. I would also say, when you're trying to figure out what agencies there are in your state, don't forget to just reach out to your state Department on Aging, and they're called different things, but here ours is called the Department of Disabilities, Aging, and Independent Living. But if you just type in an internet search, your state and Department of Aging, you'll find it, and they usually will have an inventory of the different organizations. All right, next slide, please. So the next category that you're really going to want to look into for partnering is around health services. And again, there's a whole slew of potential partners here for you, especially given the new roles and responsibilities you'll have with the IWISH program. So, I'll start off with, primary care providers in your local community. So, finding out who is there a couple primary care providers that are providing most of the primary care for your residents? And you'll be able to know that through the assessments that you'll be doing once your program gets started. And you'll want to reach out to those primary care practices as soon as you can. A lot of these medical practices have what they call kind of lunch and learns, where they bring the staff together from the practice maybe once a week during lunchtime to get a quick presentation from a community agency. And so it was lunch and learns, and that was a great way to spread the word about our program. Local hospitals, absolutely, you want to reach out, especially with the discharge planning staff. And I noticed some of the chats that came in, some people already have existing partnerships with the discharge planning staff. One of the things that we did is we worked with the head of discharge planning at one of our local hospitals to come up with a form that we would use when we had a participant that was going to the hospital, either planned or unplanned, and we would fax over this form with the basic information that the discharge planning staff said would be really helpful for them to know about kind of what this person's home environment is. So that was a great partnership. Again, there's so many pharmacies. Is there a particular pharmacy or a handful that most of your residents go to? If so, reach out to those pharmacies. Maybe they can come and do some brown bag sessions on medications. Maybe they can do flu shot clinics. Maybe they can come and do presentations about the value of bubble packs for medication reminders. So lots of ideas there. Nursing homes is one that we really worked early on to connect with our local nursing homes, and one of the things that they were able to do for us is a lot of them were willing to come out to our congregate housing settings and do presentations on, how to prepare for a short-term rehab stay. So if you know you're going to be going in for a planned surgery and going to be going to a nursing home for short-term rehab, what are the things that you should know to be prepared for that? And then what you're going to want to have at home to be ready to come home and stay home and not bounce back. So, hopefully those are some good ideas. Next slide. And then the third category, broad category, was mental health services. And, that's something that we have found that we definitely have many residents with different varieties of mental illness, some diagnosed, some undiagnosed, and really reaching out to organizations that have expertise in this area has been vitally important to us. And some of the different organizations that we've reached out to, we have community mental health are funded, have some state funding, all of them do, and my inkling is that most states have some form of community mental health centers that are funded in some form or fashion by the state, so you could look into that. Another organization that I would highly recommend that you look into is the National Alliance on Mental Illness, and that's the NAMI, that's the bubble that says NAMI. They have a wonderful website, and this information will be sent to you with the PowerPoint, but where you can go onto their national website and find your local NAMI program in your state, and that state program will provide you a list of local support groups around mental health for family members and support persons, as well as support groups for people that have mental illness. So a peer support group, these support groups around the state. I know a couple of you mentioned substance abuse treatment and programs as partners. Absolutely. We reach out to our state Department of Health. They have a alcohol and drug abuse division. Most of them do, so that's a good place to go to find out what the resources are if you don't know resources around substance misuse. Next slide, please. All right, so, I just went through a whole bunch of different partners and potential agencies, but I'm really just, peeling back the first layer of the onion. So, who else? What other organizations or partners that don't fit neatly into one of those three categories, but could be really helpful to your residents, could you think of to partner with?
And Molly, this is Chrissy again. As people are typing things in, I just wanted to shout out to one of the partnerships that people wanted to develop from group chat previously while you were talking is agencies with medical equipment. So partnering with those kind of agencies to attempt to get some free pill boxes or cutters or other items that they might be able to provide to residents at little to no cost. So that was one of those that I thought was unique and a little bit different. So, but as we talk, people are starting to come in. Legal aid is coming up as one of those partners that don't easily fit into one of our buckets, but is very important. It seems like legal assistance is one that's coming up actually a lot. Right. Churches, which provide social activities, is another one. Are you seeing anything that is exciting to you?
Yeah, I thought somebody listed something like an accounting, something about accounting, and my sense is that it's about getting support for residents around financial planning and budgeting, and that's definitely an area that we've found that our residents and participants can use assistance with, and can cause a lot of stress for people and anxiety if their finances kind of are not in order, or they're not able to keep track of their budgets like they used to. So community action programs is another really great resource for that, as well as area agencies on aging, but it sounded like somebody also had kind of an organization, accounting organization that they use. Yeah, there's some really great, a food bank. I just saw food bank was listed, which is one of the ones I was going to mention as well that don't really fit perfectly in any of those three categories. Another one that we have partnered with is refugee resettlement programs. If you have a high level of, refugees that have, or immigrants that have come into your housing, there's usually a refugee resettlement program to reach out to. United Way is another organization that we partner with. Colleges and universities, I can't underscore that category enough. We use lots of students, both undergraduate and graduate students, to provide for internships and programming and work with participants and residents who are socially isolated. So we've used social work students, nursing students, pharmacy students. We have just a ton of pharmacy students that come through every summer to help with medication issues and do education programming. Visual impairment organizations, that's another partner that we've used pretty extensively here in Vermont. So hopefully that's helpful to hear of some others. Really great, a lot of great ideas coming through. Someone just said hearing and speech resources, so I think that's another fantastic one. Mm-hmm. All right, next slide. All right, so we've covered kind of the why partner, the who do we partner with, and what I wanted to do now is shift us to, so how do you actually identify and make contact with partners, either new ones or existing partners for which you want to expand your partnership given your new and expanded roles. So here's some ideas on how to identify partners. And I think the first one, ask the experts. And what I mean by that is, your residents and you. Don't forget what I think is the obvious. I know a couple workshops ago, the idea of having a resident advisory group was discussed, and that's having, a small number of residents within your housing that you can turn to brainstorm with and get ideas and check in on how the program's going. So, you can ask them, what organizations do they get assistance from currently? What organizations have they been really happy with? So that might be a great way to first start identifying potential partners. And then, don't forget to find time to just, for the wellness director and the wellness nurse to sit down and just brainstorm what you already know about. What organizations you're already partnering with, and or maybe ones you've heard about that you just hadn't gotten to yet. So really kind of setting aside some time to have that brainstorm session is really important. Do an inventory of existing formal or informal collaborative partnerships. I'm going to share with you later in this session a resource checklist to help you with this, to kind of an inventory checklist I think that you'll find really helpful. Go to your community information centers, things like the library. It's amazing how much information is just on a bulletin board at the local library. I'm always amazed at that. Your municipal or county government or town and village-centered government, and you go to the town clerk in any of our towns here, and you'll get a whole wealth of information about different organizations and programs that are helping older adults and adults with disabilities. So I would not overlook those organizations. Over 50 expos. There's lots of these I know that go on all over the place, and there's lots of different vendors that come to those. You can learn about hospice organizations there. You can learn about personal organizations that provide personal care. It's just, you name it, they'll be there. So I would hit some of those. And then, the old standby, searching online. It's a pretty powerful thing to get online and search Google, Bing, whatever it is that you like to use, and you get better and better at refining your searches as you do it. But that's, pretty basic, but it's amazing how much information you can get back from a pretty simple search on the internet. Next slide, please. Okay, so tips for approaching a new partner. So let's say you've had this brainstorming session and you've realized that there's an organization you've never partnered with before, and you really think, given the needs of your residents, you need to reach out to this new partner. So how do you get started? So what I would recommend, first of all, is to really know your own program and your own organization. So, describe your own assets. Know what your assets are. And what I mean by that is, the staffing that you have available. You want to be able to describe to a new partner, this is what we have on site. Here's the, we have community space for this many people to do programming. It's private or it's not. It's secure or it's not. We have easy parking. You don't have to pay for it maybe. If there's an outdoor covered area, that can be important to share. And then just whatever existing programs you already have. So be sure to know your organization and your assets, and that's a great way to be ready to talk to a new partner. You want to describe IWISH. And I know a couple sessions ago you all worked with Stephanie on developing an elevator speech. So you want to have that handy. You want to have your elevator speech when you're meeting with and approaching a potential new partner. Besides that, you also want to be able to really clearly describe the new roles for the resident wellness director and the wellness nurse. In order for a partner to really get a sense of how they could work with you, they need to understand what you're able to do in your roles at the housing site. So really being able to provide a pretty in-depth description of what the wellness director and the wellness nurse do will be really important. I would also recommend that when you're talking to potential partners that you really talk about how the IWISH program is about filling in gaps and adding value, that it's not about duplicating things that they might already be doing. Sometimes our experience is that sometimes potential partners that don't understand what you're bringing to the table can feel threatened at first and feel like maybe what you're saying is that they're not doing their job or haven't been doing it well enough, and that's why you feel like you have to come in and do it. And in fact, what you're saying is the opposite. You're saying there's plenty of work for all of us to do, and can you help us identify where the gaps are, and we're a resource here to help fill in the gaps, and we can add value to what we're all trying to do, our shared mission. I would also say, when you're approaching new partners, to start small. Come up with some kind of, small pilot or, a limited idea that you can then, once it's successful, you can really seize the victory on that and then let it grow naturally from there. As an example, we had learned when we were, just a couple of years ago with our program, we had learned at a conference we were at where we had heard about our food shelf program in the state that they were struggling because they had this perishable food that they had, and they were struggling to get rid of it in a timely fashion, that they had, fruits and vegetables, and their kind of delivery mechanism across the state was challenging them, and so by the time they'd get the food to a certain destination, the food was already not, kind of rotting, I guess. So we talked to them about the fact that, well, we know that we have participants and residents that were struggling to afford good, healthy, fresh fruits and vegetables, and we had the infrastructure to provide not only a place for them to bring the food, but we had, outdoor space for them to drop it off, indoor space as well. We had staff that could help with the coordination of the delivery and the pickup on site. And so, our staff could make sure that we'd have residents, ready to pick up the food when it came in a very kind of organized fashion. We have started providing, a lot of our staff providing recipes and doing healthy cooking sessions with the residents right after the drop-offs of the food. So that really, you're really getting some nutrition basics covered as well. So that was, an example of a new partner that we hadn't thought about at the very beginning, and realized that we both had needs and we could be stronger by coming together. All right, next slide, please. So strategies for expanding existing partnerships. So I know a lot of you, and based on the chats that came in, you already have some amazing partnerships in place. So, but the fact is, with IWISH, there's also things that are changing about what you do. So it's important to seize on that change and figure out if there's some ways that you can make some of your existing partnerships deeper and maybe more expansive. So some strategies for expanding existing partnerships, you want to identify a specific area for expansion. So you want to, what's the idea that you have in your head that you want to explore with the current provider. So have that thought out. And again, it's probably a brainstorming session between the wellness director and the wellness nurse. You want to meet with that existing partner, and again, you need to explain the IWISH program because they may, obviously they've been a partner of yours, but they haven't experienced what the IWISH program is about. So again, remembering your elevator speech, and also explaining very clearly how your new roles with IWISH are different than what was happening before, so your existing partner can understand that some things have changed and there's different value that you're able to add now. You want to keep an open mind. So even if you had a very specific idea in your mind that you wanted to pursue with your existing partner, you want to be able, you really want your partner to embrace and really kind of own the expanded partnership. So making sure that you're really brainstorming together with your existing partner on a new idea will be really important. And again, emphasize the added value that the IWISH program is bringing to your existing partnership, and that this is not about duplicating any of their efforts, but adding more value. So, an example where you might want to expand an existing partnership, let's say you have an existing partner in your local home health agency that has, for years been offering a falls prevention class annually during September, which is Falls Prevention Month. I think we all know that. So they've been doing that once a year. You can always count on them, and that's great. But what you might want to do now is think about, could that same organization start a monthly class on falls prevention that, touches upon the proper sizing of walkers, how to do home safety checks, what to look for. And, would they be interested in more of a presence, so a monthly presence at your site rather than the annual one? And the value that you all can bring with the IWISH program is you have the ability to help coordinate these monthly visits by the home health agency around falls prevention. And you can also outreach to particular residents in your housing site that could really use further information and education around falls prevention, because you're going to have information on those residents that have a history of falls and that didn't score well on the falls risk screen. So that's the value that you would now be adding to this partnership equation because of the IWISH program. All right, next slide, please. The question comes up about, whether or not the partnership should become formalized. And this is, there's certainly not a requirement with the IWISH program that your partnerships that you pursue have to be formal partnerships. That said, you may realize that you'd like to have more formal partnerships. And answering that question, there are really a number of factors that you're going to want to consider. One is, what is the type of service or resource that's going to be provided? Identifying that is going to help you decide whether or not a formal partnership is necessary or would be helpful. Obviously, the willingness of a partner to enter into a formal agreement where roles and responsibilities are specified it will be an important factor in determining whether a formal partnership is needed. Would payment be expected? If so, you're very likely going to be looking for a formal partnership with an organization. And then lastly, another thing to consider is will resident information need to be shared? Again, if the answer to that is yes, you're very likely looking down a path of a more formal partnership. Definitely have formalized certain partnerships, and one example that you might think about is you have a home health agency that you'd really like to start offering monthly foot care clinics. That would be a type of program that you really want to think about a formal partnership on for a number of reasons. One is that there's likely going to be some kind of payment expected by the home health agency for the foot care. There's very likely going to be a need for some health information to be shared. Foot care is a very important type of health care. If people have diabetes, you have to be careful about doing foot care. So it's very likely that some health information is going to need to be shared. And if you want this clinic to be happening on a monthly basis, then that's another reason to formalize the partnership so that there's really clear expectations about when the partner would be coming on site and what the responsibilities would be for the IWISH staff as far as making sure the community space was available, and making sure that people are signed up for the service and that they've come down for it. So that could be a really good example where you want to try to pursue a formal partnership. An example where, let's say you have a lot of kind of residents with social isolation issues and that are looking for some more intellectual stimulation, and you decide to pursue a partnership with a local library to, maybe come and facilitate a monthly book group on site. I wouldn't think you really need a formalized partnership for that, because, as I would look through those 4 factors to consider, most of those, you don't really, you're not going to be sharing personal health information. No payment is going to be expected. So certainly a more informal partnership would make sense with a local library. Doesn't take anything away from the value of that service they would be providing, just has some different factors to consider. All right, next slide. Okay, so I wanted to get some participation here. So let's think about another example on whether or not you would want to, think about who you'd want to reach out to and if a formal partnership would be needed. So let's say you determine after looking at your assessment data on your residents that a good number of your residents have challenges around nutrition. So they're scoring at moderate to high risk on the nutrition screen that's part of your assessment. And you realize that you could really use more education on, your participants could really use more education on how to get proper nutrients, especially when they're just cooking for themselves. This is a pretty common challenge. It's hard to cook for one person and cook healthy. That's what we've heard a lot. So, some of the questions you want to ask are, what agencies could you reach out to for help around that? Do you think a formal partnership is needed based on the 4 questions I raised on the previous slide? And then also, who on your team would be good to reach out on this? If we go to the next slide, we're looking for some participation here. So in that example, tell us what organization or organizations would you think to reach out to with that example I laid out. That's a great one. So someone said a local nutrition counselor or the food bank. Culinary arts college, that's a great idea. Oh, that's great. So a friend of mine who's a dietitian, see, that's great. Using your own expertise. You know you have a friend that does that might love to volunteer. That's a great idea. Any others? Local farmers. Oh, that's great. Again, another food bank. Lots of ideas. Great. Some of the, that was a real example. Are challenged by, our participants having some, difficulty with their nutritional health. So it's something that we've really spent time trying to dig into. Who are the right partners, and what are some good programs to bring? And we've partnered with the local university, their dietetics program. We've had interns come and do programs. Our agencies on aging have nutrition programs as well. We've partnered with primary care practices that have nutrition experts on hand, and have come on a weekly basis and met with a core group of participants that have high nutritional needs. So we've really come up with some creative partnerships. So again, it was really about identifying what that need was in particular, and then meeting with a potential partner to brainstorm ideas, and then to come up with, as clear and straightforward a program as you can at first, and hopefully have a victory with it and then expand. So thank you. Those were some great ideas for other organizations to partner with. Next slide. All right. So what's the role of the wellness director and the wellness nurse in this community partnership work? Go ahead, next slide. So there's a number of roles for you all in this part of the IWISH program. Creating an inventory list of potential partners, and we're going to just go over in just a minute some tools to help you with that. So you want to create a list, and you want to be able to track the list as you make contact with potential partners. You all can help identify staff at your housing organization that have a connection to a potential partner. And again, it may not be you. Remember that IWISH is a team sport, so it could very well be that it's your CEO that has a connection with a particular organization. It could be your head of property management that you know has a connection to a particular organization. So you'll want to meet with them. You may need to teach your CEO the elevator speech for IWISH, and that would be fantastic. So it's really more about you identifying who the partners are, and then figuring out who's the right person in your organization to make the connection. And it could be that it's you, that you really have the right connection, and that you just need to reach out and start that conversation. And again, the wellness director and the wellness nurse want to develop a plan for tracking the partnership. All right, next slide. Okay, so what tools are available for organizing the community partner organizations and the community resources? And there's a couple that I wanted to share with you. One that's been put together by the IWISH folks, and go ahead to the next slide. And this is called the Getting to Know Your Community activity sheet. And this is just, what I'm giving you here is just a quick snapshot of it, but I believe it's either been sent to you or will be soon. But it's an actual worksheet where you can go through the wellness director and the wellness nurse and really walk through all the different things we talked about, inventorying your own organization's resources and assets, and then doing an inventory of the surrounding communities. So who are the organizations you already partner with that you want to expand, potentially want to expand your partnerships? Who are the new organizations that you haven't approached yet? It'll walk you through the different action steps that you can take. So I really recommend that this is really a ramp-up activity that the two of you can do, now. Really kind of coming up with your kind of roadmap for making connections to community partner agencies. All right, next slide. I wanted to share with you a resource that we get some ideas from you all on what's an on-site activity that is currently going on or you've done in the recent past to help reduce isolation amongst your residents currently. I know this is pretty much one of those areas that happens all over where our residents are very socially isolated. So what are some ideas you guys are currently doing or programs you already have on site? Someone said senior companions, which is great. Color Me Social, I like that. Buddy programs, fantastic. Weekly coffee hour, yep, we have a lot of those. Movie days and game days. Monthly birthday celebrations. Memory Cafe, that's great. We have one of those up here as well. So it sounds like a lot is already going on in your birthday. Yeah, here we go, birthday celebrations again. Coffee hours. Bingo. I was waiting for that one. I knew it. Movies, meet and greet. Yeah, lots of options. So karaoke. Oh wow. Okay, that's a great one. I don't know if we have that going on here, but that sounds great. So we definitely have lots of great ideas already going on. Art class, definitely. Super. So hopefully that gives lots of ideas for everyone. And I can tell you that there's more and more research out there now about how important it is that people are not socially isolated because of the impact it has on people's health, whether it's their heart health, chance of stroke. All of these things are heightened when people are socially isolated. So those coffee hours are, it's much more than a nice to do. It's a really important program to have to improve your residents' health. So that's fantastic. All right, next slide, please. Great, and I wanted to say that one of the, if you've gone through all of this, all these charts, and done your inventory, and you're still not finding a particular, existing program or an existing partner that does a particular thing that that your residents would really like to be able to do, this is where this huge value that each of you bring to IWISH is your creativity. So if it doesn't exist, then be creative and make it happen. If you have residents that are interested in writing their life stories, this is something that has come up here. And there wasn't a particular organization that was offering programs around writing your life stories. You can contact a local university. Is there someone in their master's kind of English writing major that would be willing to lead a group on that? Do you have residents that are interested in learning how to do watercolor art? If yes, do you have an artist in your building? We have a program, a watercolor class that goes on once a week, and it's the resident themselves that leads the class. So don't forget about, again, talk to your experts, your residents. What can they offer as volunteers to bring programs? And just as like someone said, reaching out to their friend who's a dietitian that could come in and do programming. So don't forget about the huge value that you all bring, which is your creativity. All right, next slide.